Alright, well, I just stopped in Polo, Austin to see Dr. Fullerton for an assessment, not a treatment, but just a chance for him to check everything out because he seems to be more effective when uh, he does an assessment separate from a treatment. And he looked in all the places that I didn't think he would look at, and I think all the spots he looked at were the spots that he needed to. He's pretty impressive. Ended up pressing on the spot where my Terres minor and Infraspinatus connect around, and when he pressed on that, I could suddenly retract my shoulder blade without any pain. So that was really surprising. So he's going to look at that. He's also going to look at some weird muscle that I can't even remember right now, but it connects to the humoidal bone. It connects to the top of the scapula, goes by the clavicle. It's not connected to the actual clavicle, but there's a ligament or some ropey thing that kind of like loops to, and then it connects up to, it's a floating bone in the neck. And that's the humeroid or whatever. And so it's this weird little muscle, and he wants that checked out. And that might actually be the source of all the last remaining bit of the puzzle. Might not be, but it certainly is a piece. Concerning my hip, I showed like all these movements that hurt and all these stretches that hurt, and thinking maybe it was a glute med or glute min or something like that, and instead he looked at my QL, and I know that muscle well because I've had a lot of pain on the other side. But he looked at that and he poked around, and when he was palpitating it, it definitely caused a lot of pain and discomfort and seemed to be the right spot. So I asked him if issues with the QL would cause the symptoms I'm experiencing, such as like trying to raise my knee. The groin doesn't feel right, like it feels like my hip capsule isn't being cleared, and thus my groin is pinching. It's very uncomfortable. And he said that it would explain that symptom. So so maybe this is the last treatment, maybe this isn't, but it's what he has discovered is definitely an issue that needs to be treated, and that is what I'm going to do. Going to wait, obviously, it's mid to late December, going to probably see him in January when my FSA account is filled back up, and we'll go from there. Yeah, kind of excited. Maybe this is it, maybe this isn't, but I'm looking forward to getting this over with, and I feel like I'm definitely taking yet another step in the right direction. So this is Adam signing off.